I thought I'd do a video log. It might be easier to just express myself in person than trying to write everything out. And most often I find that when I'm nutting something out, it is much easier to verbalize in order to internalize. So, even if I'm just talking to myself, it makes sense. So we've got to be careful what we wish for. And essentially I sort of said, when the medical oncologist suggested that I do chemo, and it wasn't a suggestion, she's quite emphatic about it. I just flatly, I just said, I can't do that. She basically wanted 6 months worth of chemo, initially weekly, then a couple of weeks fortnightly, and then I'll just show you the cats wanting a lot of attention. Look, this is girl cat. Very insistent. So essentially, oh, she's so cute. And so I sort of said to her that, I can't even imagine or fathom ever doing chemo. And I don't think anyone on a cancer journey ever wants to do chemo. We don't. No one does. No one in their right mind would do something like that. So I then asked for the Prosigna, which is basically, a $3,000 genotyping test where they look at the tumour and they look at your tumour and its, I guess, the statistical rate of recurrence. And so I thought I was being very smart. I was prepared to spend that kind of money so that I could be supported medically in saying, no, chemo's not going to be warranted. And so the results came in this week and it's not supporting that at all. I was hoping that I would come in as low, and I've come in as intermediate. So that's an intermediate risk of it recurring. And so things have changed a little bit. I'm still recalibrating. The medical oncologist offered me an olive branch, and the olive branch is that instead of doing the 3rd generation chemotherapy over 6 months, we go 2nd generation, and instead of weekly, do it each 3 weeks for that 3 months. What that means is maybe, I can say yes, because, 3 months in the great scheme of things, 3 months isn't a long time. It's 4 doses, and that's what I'm sort of nutting out, is that, here I thought I was being very smart, but all I was actually doing was collecting further evidence to support that my risk was in fact there. I think what has actually been explained to me, and I'm very grateful for some very patient friends, medical friends, that the problem with breast cancer is that it's not a short-term cancer. It's more like a marathon. And in fact, when running this marathon, we don't call survival rates at 5 years. So when I was looking at the oncologist's original predict tool, and it said, 89% survival at 5 years, I was like, well, that looks great. And I was reading it at 73.4% survival at 10 years. And I thought, okay, well, this is an old person's cancer, and as a result, of course, people are going to start dying. I'm a young person, my statistics will be much better than that. And so, sort of chatting to some rather specialised doctors and people who are really into numbers and statistics, really gathering all my information. I guess it's intellectually on one level supporting treating me as a system or systemically, and the fact that the cancer has travelled from the breast into the lymph nodes and survived in that hostile environment and taken sort of root is level, reason for concern that it could have gone elsewhere. And I think that, as it was explained to me, that even though it was a microscopic, two little microscopic tumours in the lymph node on the left, it indicates that, it has survived outside of where it was, and it has travelled. And, usually they're not going to pick up those microscopic levels under CT scan. CT scan is when they are able to, take pictures of your body, almost like a loaf of sliced bread. And while they used to be sort of 1 centimetre slices, technology's improved and it's much smaller than that, but certainly not small enough to be able to pick up a 1 millimetre or 1.5 millimetre tumour. Hence the concern that, if it has travelled anywhere else in the body, it needs to be treated. And this is one of those diseases that is metastatic, and, while you think that you have sorted everything out at the time with a bit of surgery, having this four-pronged approach, surgery, chemo, radiation, and then hormone therapy, what it is in fact doing is looking at trying to increase the long-term survival. So I am struggling. I'm really struggling with the whole chemo idea. I don't really want to enter into any debate with any person. It's not a decision that I have come to make lightly. It is my decision. I do take personal responsibility for the decisions and the choices that I make. And, I think that intellectually, sitting down, listening to all the advice, gathering different bits of information, if I could have gotten out of this on an intellectual level or in any which way, I would have done that. I have tried to run from this as much as I can, and I certainly do not go down this path without feeling really, really yucky about it. And, I do need to, one of my big things is everyone said, what if you don't do all of this and then metastasizes and goes elsewhere? What about those regrets? And I don't think I'm, I think my big fear is that I do all this and then it does metastasize, and I have wasted then this entire year going through a fairly revolting journey for no reason. And that's probably more where my fear lies. And that is something that I'm really struggling with. Doing all this, inflicting this on my body, and, nothing is a guarantee. And, really questioning, why am I putting myself through this when I have seen that other dimension, and I have seen it's really impressive. It's incredibly beautiful. It's phenomenal. And I'm not afraid of dying. What I'm most afraid of is the journey. And that journey is, I don't know, I'm going to be going and travelling that journey that I'm most afraid of. But I guess at this point in time it's about surrendering, accepting, surrendering. And I think that's the end of